here. This is Ben and Casey with Inspirations Memory Care and Assisted Living, and talk about a truly pioneering assisted living community. Tell us what we're looking at here, Ben and Casey.
We have our 4 alpacas. People like to call them llamas, but they're really alpacas. It's the darker one is espresso, and then macchiato, caramel macchiato, and frappuccino. And Ben is feeding him right now, and we also have Fran feeding him, and Wendy, and our director Christina is here. So we're just out to share with you what we can do with our residents, and
that's your community right there in the background, correct?
Yeah, that's our community. There's people on the porch right now.
Wow.
It's hard to see them, but yeah.
Tell us real quickly, your locations are, you've got 3 locations.
Yes, Linthicum, Westminster, and Lutherville.
And where are you right now?
We're in Westminster, and I'll do a 360.
Okay.
We have a run-in shed behind us, and then a front pasture where we have some other friends that you'll meet next week. All right. And it's a farm. It's laid out as a small little farm. There's a barn. I must smell like horses. It's a barn behind me, and then a house purpose built for assisted living. 16 units.
So cool.
Here.
And Ben, real quick, for the people that weren't on last week where we met the baby chicks, just give the brief overview of how the 2 of you got into creating such innovative assisted livings.
We helped others for 30 years, and we connected at an event, and Ben joined me about 15 years ago, and we continued to do a consulting, helping others to do this. And from what we've learned, we're using best practices, which is really only 5 or 10% of what we've seen. We've seen thousands across the country, all over the country, Puerto Rico, California, the entire United States. So we're using a little bit of what we saw, and we try to give people new purpose, and we use creativity to help uncover what brings them energy, light, and joy. Awesome. So we measure that success by laughter. So animals are very much a part of that.
I love it. Well, guys, again, thanks for being our September sponsor, and keep it up. And we look forward to seeing you next week and meeting some more animals, or more residents, we should say. So thanks a lot, guys. And folks, just reach out to Inspirations to learn more about what they're doing. Just a truly pioneering model there. So with that, now let's get into our panel. So I am going to be bringing on our panel members here. We got Mark Baumgartner with the National Adult Day Services. We got Anita Irvin with Insight Memory Care. We got Lauretta Byers with Keswick and a board member of the Maryland Association of Adult Daycare. And we've got Rosita, who is with J Health, which is a technology solution that adult daycare are using. Well, welcome everybody. And I'm just gonna go around the little Brady Bunch square here first and just get to know each of you. And then we will move into the panel presentation where each of you sort of shares some insight on adult daycare, COVID-19, what's going on now, and what the future is holding for this important segment. And let me start with, I'm going to go counterclockwise on my screen here so that I land with Mark, who's going to be our first panel member. So let me start with Lauretta here. Lauretta, tell us a little bit about yourself.
Hello, everyone. I am Lauretta Byers. I'm the director of Keswick Adult Day Services. I am also a certified dementia practitioner and a certified dementia trainer. In addition to that, as Steve mentioned, I'm also a member of the Maryland Association of Adult Day Centers Board. And I've been with Keswick for about 5 years. I've been in the adult day services field for about 7. And prior to that, I did a lot of work in mental health. I'm happy to be here.
Awesome. Okay, we're going to be getting back to Lauretta here shortly. And I've got Rosita is the next one on my little square here. So Rosita, I'm really psyched to learn about HealthJay. Tell us a little bit about who you are, and we'll get into your product here shortly.
Right. Well, good morning, everyone, and thank you so much, Steve. This is very exciting to me. I think we're heading into a paradigm shift for the industry from, somewhere not so much embracing all the technology to, hey, here we are. We need to look at technology as a solution post-pandemic, where we are going from here. Our company, it's HealthJay. We are an ecosystem that provide devices from tablet to a watch to back-end admin portal to help seniors and clients with behavioral challenges and IDD to go on virtual programming and see how we can connect centers to membership and even grow their membership. So I'm looking forward to interact with the panel as well as your audience today.
Great. Okay. Thank you. And then next on my little screen here is Anita with Insight Memory Care.
Hi, good afternoon. Thanks, Steve, for inviting me to be a part of the panel. My name is Anita Irvin, and I'm the Executive Director at Insight Memory Care Center. I have about 25 years of experience from long-term care and joined Insight a year ago and accepted the Executive Director position of June of this year. Insight is the only dementia-specific adult day center here in the Northern Virginia, Washington, D.C. area. We've been around for about 36 years. And when COVID hit us in March, we shifted everything pretty quickly. So I'm excited to be a part of the panel and to see how we can continue to explore this together.
And did you say starting the position June of this year?
Uh-huh.
Yeah, nothing like starting a new job. All right, but we're all in the same boat, so great. Well, we'll talk to you soon there, Anita. And that now I have landed on our last introduction, but our first panel member. This is Mark Baumgartner with the National Adult Day Services Association. He's a board member there, but also, an independent operator. And Mark, tell us a little bit about yourself.
Sure. So I am on the national board. I'm also the president of the North Carolina Adult Day Services Association. I would have been past president in April, but COVID. So I'm looking forward to our membership coming together so I can say I'm past president now. And then I am the executive director for adult life programs. We operate 3 adult day service centers. I'm specializing one in dementia, one with IDD, one with chronic physical health issues, and then we have a separate center that operates for the chronically mentally ill. It's a behavioral health model, a psychosocial rehab. So I've been fortunate enough to have this macro view of the crisis as well as a micro view, if that's fortunate.
Excellent. Well, Mark, really charged up to have you and the association represented on this panel. Maybe if you can kind of tell us a little bit about National Adult Day Services Association and kind of give us a global view, and then we'll kind of go through our panel. And I think what I'm going to do with the panel members, if it's okay, feel free to keep yourself on the screen, okay? Because what we want to get to audience questions as quickly as possible. So I think if everybody's on there, but I'll let you guys take yourself off the screen if you'd like when one of the other panel members is speaking. The other thing that I'll say to the audience is that if you select the speaker view in the back, in your, on the upper right-hand corner of your screen, then you'll only see the person really who is speaking at that time. So that's another solution. But But yeah, Mark, yeah, share with us.
Sure. So it was really, COVID was clearly a time in our industry that we've never encountered before. And the National Association, I was very proud with their response. They were quite nimble. So normally we are always working on funding issues. We're working on legislative issues. We oftentimes are reaching out to our legislators to talk about specific pieces of policy that benefit our industry. This was a little different, and what was really exciting was to see how we all came together from our different states and our different backgrounds and began to work together so that we were able to offer plans for states to utilize. We were able to offer funding models from one state to other states who were looking for those. A number of our states pretty quickly adopted in lieu of payments or retainer payments. We were able to gather that information, synthesize that, get that out to other states who were looking to build programs so that they had models to replicate that we knew were supportive, not only of our members, but of everybody in this industry. Likewise, the National Association pretty quickly began to act as a clearinghouse for those of us that either remained open or opened up early on to be able to secure PPP, personal protective equipment. Those pieces of equipment were very short in supply and the prices skyrocketed. So being able to find vendors that ensured continuity of supply chain as well as prices that were affordable for us was critical for our members and our industry. We continue to work on legislative pieces. I know at one point I was very excited. The association reached out to me. We have been having conversations with Nancy Pelosi's staff and asked if I would send a letter to Speaker Pelosi asking her to support specific pieces of COVID funding for our industry. We continue to do that. So it's been exciting for us in the sense that we always talk about how we're a leader in our industry. And in this case, I think we absolutely put the pedal to the metal and really hit the highway open and going. We continue to work diligently to make sure that our industries and our members have access to what they need and have representation and funding. Funding, I think, has been a challenge for many of us. Many of us, as you heard Rosita speak to, had to switch models. Those of us who've never done telehealth, suddenly we're having to do telehealth to be able to keep our funding in place. And so the National Association, again, was able to offer support in that, able to offer guidelines, and really did a good job at giving us information about products and services that could help us keep our services in place. So Steve, you're muted.
Sorry, I did that intentionally because I was typing and I didn't want to interrupt. But yeah, in general, our field of senior living, we really have to come together, and especially now, and make our voice heard. We don't have as strong of a lobby as many other industries, and so it's great that that the association is there and that you're making steps to recognize it. I have to say personally, I've always known that adult day services were valuable, but this pandemic has really reiterated how important it is for those families that are aging in place and have a loved one with cognitive impairment or issues. And when those centers shut down, the amount of stories that I've heard where, families were scrambling around, and this is really a vital part of our aging in place solution. And people need to know that.
It's really interesting too, Steve. I'll tell you, we are seeing a trend, and as we've talked with centers in Indiana, in Virginia, Anita, we're all starting to see sort of a similar trend, and that is seniors who initially might have used programs in the community like Seniors Morning Out, senior centers, Meals on Wheels, when those programs shut down, we really saw them decompensate. Many of them seem to be ending up in hospitals, and now we're at a point where those services, even if they are available, aren't enough to support them. So adult day centers who are open are beginning to experience waiting lists from people who traditionally wouldn't have been folks we would have served, but now have moved into that realm quickly. So there are many opportunities and obstacles at the same time that are presented for us. And if I could put in a plug for our conference.
No, you were reading my mind. I wanted to make sure that you did that.
So that led me right to that, because as we look at these new, again, obstacles and opportunities for us, one very valuable resource is our national conference. One of the reasons I've always loved NASDA is I love the national conference. It was great to connect with members across the country, to make those connections, to have those resources. In this day and age, we had to take a hard look at how do we do that? We know that's valuable, but we can't do it the way we used to do it. So we will be doing a virtual conference this year, and the dates, because it's virtual, it gave us a longer opportunity of time. So it's not quite as condensed as a conference would be, so that those of us who are still running centers can pay attention to that and do that and still gain from this conference. But we're starting breakout sessions on October 7th. We'll have them on the 14th and the 21st. We're doing some deep dive workshops on October 28th and 29th. We have the vendor showcases that are open on the 8th, the 15th, and the 22nd. There's a virtual trade show. There's a live virtual trade show that will happen on November 4th. Many of these don't require a fee, just registration. Some do require a fee, but I encourage you to visit our website at NADSA, NASDA, as we like to say, .org. There's lots of information. That website also will connect you to our director, to our legislative director, and to other board members like me if you would like to.
Thank you. And I'm going to move to Anita, but if Mark, if you or some of the NASDA people in the audience can type in those links into chat, then that would be great. And there is sponsorship opportunities available, so that's a great opportunity. Thanks, Mark. We'll definitely hear from you more in the Q&A. So let's move to Anita with Insight Memory Care. Anita, tell us a little bit about, what's been going on at Insight. So we got sort of the macro view of the industry. Now I'd love to sort of dive into what's going on the front lines, and what do you see as the future? What are some of the things that you guys are looking at for the future of adult day services?
So when we closed our doors March 16th, we stayed closed for 3 months. And as Mark said, we had families that were knocking on our door saying they needed us. And obviously, as you stated earlier, Steve, the need was even greater with people not having a break and respite at home and having those supports. So we pivoted all of our services. We created more virtual support groups, which allowed more interaction with families and allowed us to touch more families during that time. We actually pivoted all of our programs online, which meant we were doing trivia and brain games and music programs online with our participants on a daily basis for 2 to 3 hours a day, as well as making sure that our education programs for our families were still going on at that point as well. So literally we put everything in a box, and then we pivoted it. And then we actually put together, when we shut our doors, Steve, a comprehensive plan where social workers were calling families to make sure that there was no depression going on with both the caregiver and the participant, and the nurses were calling to make sure there was no significant health changes with those participants as well. And we realized when we were able to bundle that we got some long-term care insurance policies to actually pay for that time, even when they weren't in the center, which was pretty amazing. And since then, we have opened our doors. We opened our doors starting June 29th, and we are currently serving 20 to 24 participants per day. We opened in September for the full 10 hours with very, very strict protocols that we're following at this point in time. And we're still getting to a point where we're, where does this take Insight? That's still evolving. It's an everyday sitting down brain session with all of our staff and strategically thinking about how do we cast a net to serve more people who desperately need our services, who may not be ready to come back into a center, but there's other ways that we can still reach them. So we're doing virtual memory screenings, we're doing virtual consultations, we're doing all of those things and still being able to reach a lot of people even in this difficult time.
Great insight. And forgive the pun, but I again, now what you said 24 is what you've got. What was your typical capacity in terms of members pre-COVID?
So we were serving about between 50 and 55 participants per day in March when we shut our doors. And then we're moving at a snail's pace because that's the right way to do it. We're looking at reopening our early stage program a couple of days a week in the month of October. So that's exciting as well. So we have definitely scaled down. Participants have to be able to wear masks. They're 10 feet apart. We have definitely put some very strict guidelines in place. Tape is on the floor, so we know exactly distance-wise where people need to be so that we're not, people are going into a bathroom, the bathroom one at a time, cleaning before and after each person goes in. So definitely a lot of attention to detail in those, in that cleaning process and making sure that we're continuing to keep people apart but together.
Okay, and then I'm going to jump to Lauretta next, but Christina Chartland has a question. Do you have any private pay participants in your virtual experience?
We do. We do.
And does Medicare cover?
We don't accept Medicare or Medicaid, but what we did do is we took our enrollment fees, and if it was a virtual program, we subsidized it, obviously, because it's not an in-person program and it's a shorter duration. So we came up with a creative billing system during those times that we were closed.
Well, thanks a lot, Anita. And I think one of the good stories out of this pandemic is now adult day services are providing more resources, and we will never turn around from that, even when we're fully open, which is great because, so many families are intimidated about our services or intimidated about going to a center. So, so thank you, Anita. We'll talk to you soon. Loretta, with Keswick and on the board of the Maryland Adult Day Centers, I glanced into chat and I saw a question about who asked it here, was about adult daycare. Yeah, Monica Brunson says, do you anticipate day programs opening in Maryland anytime soon this year? That's the big question all Marylanders want to know.
That's the million-dollar question, and we don't have an answer yet. The big challenge right now is missing all of our participants, not being able to physically provide services to them. We have become very creative in how we do so. We're calling our families and our participants every day. I have done a couple of home visits because we're small. And when I say home visits, I'm meeting them, on the curb. I may be near my car and they're at their front door. I'm just waiting just to put a familiar face with them, because it's hard. We're talking to them on the phone. We're trying to keep them upbeat and help them maintain the resources that they need. But it's difficult because we cannot physically provide services to them in our buildings. And that's what we're here for. We're here to provide the services that our folks need. We're here to make sure that they stay out of the hospital, to make sure that they have their meals, their medications, the social interaction. And when we can't do so, it just leaves a void within us, in addition to a void within our participants and their families.
So the I think we're going to probably have this question multiple times, and I want to get into a little bit of Keswick and the model that you have there. But Robert Pierce just asked, has there been any guidance from the state of Maryland on when adult day centers will be allowed to open, even at a limited capacity?
Not yet. I have not seen anything come through from the state yet regarding a full date. I just know that we are on their list. They have not forgotten about us. There's a lot that goes into making sure that we can safely open and be that safe haven for our participants, our families, and our staff. But we are all anxiously awaiting for that green light to come so that we can go ahead and open our doors and welcome our participants back.
Now, your model of adult day is a little bit different than Insight, in that you're tied to Keswick, a campus. Tell us a little bit about your model.
So with our adult day program, our focus is memory care. And I have to say, Anita, I visited your program about maybe 2 or 3 years ago. Beautiful program, by the way. We are lucky in that we do have our adult daycare program, but we also have a community health program that we work with. Our community health program has been very instrumental over the last couple of months, actually, in helping to connect our families and participants. We've been able to provide some classes for them around nutrition and health. We have another one coming up in a couple of weeks on sleep and just taking care of yourself. We've had 2 care partner classes going on where the family member can hone in on how to take care of themselves while also trying to take care of their loved one. So it's a community-based program here where we're trying to make sure that the adult day, the community health, and the other services that we have here are that continuum of care.
That's great. Let's see, Tiffany Oscar asks, can you explain a little bit about how participants pay for daycare services if Medicare and Medicaid is not accepted? And obviously Anita brought up long-term care insurance and that ability, but Lauretta, can you kind of give us a broad overview of the ways that different centers can accept payment?
So Medicaid is the #1 payment. Private pay, some people are also a part of the senior care program that will pay for 7 days of services a month at the Medicaid rate. There are some other grants that may cover daycare services, and of course, long-term care insurance.
And then,
I would love to have Medicare pay for it one day. You know, I have heard that somewhere down the line, there's discussion about Medicare potentially paying for daycare services, but that hasn't come yet.
No,
and also,
Medicaid.
Also the VA will also
The VA
pay
has a program. Okay.
Yeah.
On Medicaid, you know, we all think about Medicaid nursing home beds and how challenging it is for families to find Medicaid nursing home beds. Is there something similar like that in adult day with finding a Medicaid, a place that will accept Medicaid and have a slot for Medicaid?
So the majority of us do accept Medicaid. I know we do not have a waiting list. My program is small. We're licensed for 39 people and I have space for 39. However, of course, when we open in the new COVID world, we will not be able to open at 100% capacity, but Medicaid is the #1 payer source in Maryland. There is a process in order to have Medicaid pay for your services, but Medicaid is the #1 payer source in Maryland.
Okay, great. Well, thank you, Lauretta. We'll get back to you. I want to introduce our last panel member, and then we'll just go Q&A until we are done with Q&A. And that's Rosita Wong, who's the CEO of HealthJay. And Rosita, we invited you on because I just got a press release literally 2 weeks ago about your partnership with the National Adult Day Services Association. just briefly tell us a little bit about your product. And actually what I'd like to do is dive deeper and have you back for a full session where we do, you know, a detailed demo. We actually, a lot of times on Fridays, we'll dive into technology, but I just thought your partnership just makes perfect sense for the future of this discussion here today.
Definitely, Steve. Well, our partnership with the NADSA was launched last week, and it has been just phenomenal. There's such a need about a migration from where we are at yesterday to where we are going tomorrow with virtual programming in a hybrid model for most of the ADS center out there. As we heard from Anita and Lauretta and Mark, this is just the way to go. It's not going back to yesterday. But how ready are we? What kind of technology we are going to use in assisting us to cater to that membership? How are we going to grow revenue out of it? How are we going to really connect family members and engagement? Those are the questions that we yet have to discuss and yet has to come up with a bigger solution. So I would like to quickly share with you what we have done. Let me see if I can quickly jump in here. This is what we are having in the market, Jpad. Jpad is a tablet that is connected to our ecosystem with a back-end support engine that allowed the centers to manage all the members' health, how they connect, how they interact, how they do programming. I understand that a lot of folks out there are now using Zoom or Google Hangout on an iPad. That's great, but that's not really working for someone like my mother or my father. My mom will drop the call when she get up a phone call with a FaceTime. She doesn't know how to hang up and she has to call my father to help out. What we are trying to do is to offer very user-friendly interface. Everything is one tap. There's no typing, there's no password, there's no links. It can be done by voice command, by chatbot, and bingo, in a second, you'll be placed into virtual conference classrooms. And so you can hold up to 50, 100 members at one time. And all you need to do is to train your members that, hey, when there's a pop-up message coming out, you just have to press the button, join now, and then you'll be instantly placed into the virtual classroom. We have a back-end support portal, which allow you as an administrator to go in to create your activity and to invite as members, as many members as you want, to change it, to set the time, set the date, set the duration of each class, and everything is tracked and billable. To make it even more easier, there's no more spam calls. We have SIM card that can be put into our Jpad. However, you don't need to type in like 415XXX. It's just you tap the avatar, that can be your caregivers, your son, your daughter-in-law, your grandkids, and then bingo, all in a sudden you will see everybody on a video call. That is how we actually spend so much time to study hundreds of seniors' user pattern and come up with an interface that doesn't scare them away. And that actually bring up to, the message I wanted to send today to the panel is that what kind of technology that we are going to trust as we really deep dive into this next phase of our ADS delivery. It's not just about the user or the administrator, it's also about how classes are being delivered, how services are being delivered. It's a big topic. For example, with the 6 feet, 10 feet social distancing, when we are delivering meals, let's say Meals on Wheels and all that programs, when we are delivering it to the residents or to the homes of the seniors, how are we gonna check that we actually are there? Well, our program has a QR code. Our mobile app can actually use GPS location to prove that your driver actually did, show up and was at that apartment where the senior is, and then you can press a button and say, I am here, and that get registered to our flight deck, which is our back-end portal that has all this documentation to prove for billing purposes. We also have integrate wellness check done by voice command, done by a chatbot, and that can check COVID. So let's say if you want to send out to 100 members every morning at 8:30, do a COVID wellness check, well, easy. It will be all automatically sent to those members, and it will pop up and say, hey, Mr. Johnson, are you ready to go for a wellness check? Do you have fever? Do you have a cough? And all that result will be captured and collected into the back-end portal, which you can, see, hey, if someone is getting sick, if someone needs to have medical attention. So this is what we have put our love and heart and soul in the last few months, and really trying to come up with something that's workable, that's something that's really go beyond just COVID. Where are we going to go from here to tomorrow? Mark did mention about there's a long wait list. I heard that a lot of folks feeling out there that, hey, we're still in closure and we don't know when is the reopening, and it's a really hard time for a lot of folks out there. However, if we can really leverage this opportunity and give the tool that's really useful to the members, and not to make them scared away and say, hey, I just used to use a Lifeline pendant to press a button to call and talk to someone in the call center. You're now giving me an iPad and I have no clue how to even navigate it. If we can migrate them to a device that's as simple as 6 buttons and chatbot and voice command and no typing and one tap, and hey, you're seeing your doctor, your caregivers, your son and your grandkids, they will love it. And it has been proven that they do love it. So I think that, one thing is about the tool that we are using, that we are entrusting our future into. Secondly is whether it engage administrator, whether it makes business sense to the center, whether it engage instructors and staff, whether it engage family members. Now, we also need to look at whether it's really customized to the ADS industry. We have created our portal and our product in a way it's so much activity based. It's about reminder, it's about enrolling them, inviting them, reminding them, and then encouraging participation. So I have a couple of example. We're working with a center in Pennsylvania, and it's a center that work with members has dementia. Their programs start from 10 a.m. to 2 p.m. In the morning, they will use our chatbot and say, hey, JJ, tell me the weather. And it's in a group conference setting. And so they start chatting about the weather. They start talking about the day in history. And then they will break out for coffee break, which is a coffee hangout that folks can talk about stories. What did you do last night? It's all video conferencing. And then we will, I think it's at around 11 o'clock, they will go for group bingo, which our program actually start to build interactive group games, and it's touchless. You don't need to put, hand sanitizer on touching cards and stuff like that. So we started to listen to the market and say, tell me what you need. Anita, tell me what you need after this panel. And if something that can be helpful, we'll be very happy as a platform. We can integrate what you need and create something for you. I think that my philosophy, and I was talking to some folks back in New Jersey yesterday, they're all going for telehealth. Telehealth is the buzzword, Steve, but what then, right? I mean, iPad is great, but it costs some money. And then Zoom Link, you're not expecting that, really Mr. Johnson in South Carolina is gonna go on the Zoom Link on time and then be able to go on there and hang out. So we show them the product and they just think, Rosita, this is it. This is something that's catered to the ADS industry and that it works. Awesome. And, we are creating programs, for example, on Sunday, you can do gardening outside and film it.
Hey, Rosita. Yeah, we're starting to get some questions piling up here. So I'd love to transition into Q&A for the remainder of our time. And like I said, I knew we could we could spend a whole hour on your product. So I'd love to have you back, and I'll schedule that, and we can do a real deep dive. But the concept here is really easy to understand with Jpad. It's sort of, if your adult daycare program, whether it's active or not active, if every member of the adult day program had a Jpad, then the adult day program is active anywhere and everywhere. And people can bring their Jpad to the center when it's opened, and you can still use it there. So if I can get you to stop sharing your screen there real quick, and then I'll get I got all the panel members there. I'm gonna kind of rip through the questions, and we'll see where we can go. And then at about 12:55, I'm gonna probably, if we're not through all of our questions, I'm gonna turn over the hosting to Mark, and because I gotta go down the hall here. But so first, this is for Anita. This is from Angela White. This is for Anita. Is your facility 24-hour care, or do participants come and go daily?
No, we're open for 10 hours a day, 7:30 in the morning to 5:30 in the evening.
Are you all aware of many sort of night programs? I know I've heard of a couple in the nation. Maybe this is a good question for Mark. Any adult day sort of night programs? Because we know memory cognitive impairment has no time clock.
I'm truthfully not aware of any night programs connected specifically to adult days nationwide. I know North Carolina did a pilot 8 years ago. We never moved out of pilot. We only had one agency piloting, and it's just kind of stagnant. So I feel like that's probably going to hold true across the country.
I believe there is one in Maryland, in Sykesville, I believe.
Well, they were starting one, and but that's Copper Ridge, and it ended up selling to Axe, and then another company bought it. So I'm not sure where that program is. Let's see. I see that Cassandra Key has her hand raised, so I'm asking you to unmute, but that may just be an error.
Lisa, no, that's fine. Yeah, I did unmute. Yes. How you doing? I'm Cassandra Key, and I'm the program specialist for Project Home at the Social Services Administration, Office of Adult Services. And just to let people know, we've been our vulnerable adults have been severely impacted due to this COVID-19 with the adult daycares, and they can't see their family with the social workers. So the state of Maryland just purchased these Echo 8s. That they can, see, and we're going to have a training, with their social workers and case managers. And here's what it looks like right now. And also, so they can be in touch. Well, I don't know if you can see it or not. Oh, you can't see it? Okay, well, but.
Wait, hold on. Here, I'm bringing you over. Hold on.
All right, here you go. Do you see it now?
Hold on, I got to do your video. Okay.
All right, let me start my video. Hold on. Oh, it's not letting you start the video.
Oh, shoot. Yeah. Well,
in any event, we do have the new Echo 8s, and they can use this also, not only with their case managers, with their family members, but also, to get in touch with their mental health counselors and everything, so they can see them face to face.
Okay, great. Well, Cassandra, put a link in chat.
Yeah, I did put the link in the chat where they can my email address and everything.
Okay, great. Thanks a lot, Cassandra. All right, getting back to more questions. Lisa Bates asks, question for Anita. Do you mind sharing what you charged for virtual visits, and how did you get long-term care insurance to pay?
We designed the program, so we had to show the outcomes piece of it for long-term care insurance companies to be able to reimburse for that. So we designed whatever our enrollment fee was, we broke it down to about 30 to maybe 35% of the program fee, since it was a much smaller program, but we put it together. We were able to track incomes, And as our families were engaging with us and asking questions, we then were the go-between between the family and the long-term care insurance to be the buffer and answer any questions they had, to be able to show that holistic approach with the social work and the nursing piece to be able to justify that piece. So it really depended upon what they were paying prior to COVID, and then we adjusted it to like 30% of what their enrollment fee was.
Okay, great. And let's see, Ann Johnson has her hand raised. And then while she's coming on, Sharon O'Connor is sharing, from Iona Day Services in Washington, D.C., people can access our program through Medicaid, VA, DC Department of Aging grants, private pay, and long-term care insurance. Lots of options in DC. We're just making the Maryland people feel really bad, that they can't open.
This is Ann Johnson.
Yeah.
And I just wanted to share that Winter Growth Adult Daycare in Olney, Maryland, and there's also a site in Columbia, Maryland, has assisted living attached to their adult daycare. And the folks that live in assisted living have access as part of the service, the monthly fee, the adult daycare services. And so there's openings in both centers, and it's an excellent program that's been around for 40 years. So I just wanted to put that out there.
Thanks for sharing that, Ann. And yeah, that model is somewhat similar to what's at Keswick, where they've got the assisted and nursing tied to it.
We no longer have assisted living at Keswick.
Oh, it's just nursing?
It's the long-term care, adult day, the Wise and Well program, but no longer assisted living. That closed, I guess, about 3 years ago now.
Oh, geez, look, yeah, it's hard for me to keep track of these changes. Let's see, Cassandra, Maryland has new technology. I would love to inform everybody. Yeah, we got you on there. Let's see, an anonymous attendee says there are currently no licensed overnight programs for adult medical day care in Maryland. Yeah, they almost got one started there. Susan Lilly says, would like to have clarification on the two types of Medicaid: medical assistance with monthly income limit of $350 a month, and medical assistance where monthly income limit is $2,113. There is a 7-year waiting list for the Medicaid waiver. What other payment sources are available in Maryland? That might have been a little confusing. So
I would suggest looking at the Department of Aging for other grants that may be available, because there is a long waiting list, and I can't get into the income portion of it because that is not my background. But I would definitely suggest reaching out to the Department of Aging for any grants that may be available, long-term care insurance, that may be able to help as well.
And this is where I turn to the audience, where if you have a resource, type it into chat, and that can be helpful. And let's see, Debbie Luddington asks, this is for Rosita, are your devices available to other programs? Do you have a URL or contact info? This is for Rosita.
Yes, definitely. We are adding on some functions for home care, as a lot of the ADS centers are now migrating slowly, delivering meals and stuff like that. So we are looking at adding on features to support home care partly. And so I would type in our website address as well into the chat.
Okay, great. And I see, Rosita, you were typing away. You had several questions related to the Jpad. And let's see. Okay, yeah, it's one place that had to close their social center. And okay, I'd like to have just kind of going. Oh, what is the pricing on the Jpad? Right, so it's $30 a month. If you are a NADSA member, it will be with a 1-year subscription, you will get a free Jpad. The free Jpad is costed about $188.
And again, if it's a 1-year commitment and a NADSA member, it will be a free device for your center to start as soon as possible to go on virtual programming.
Great. Well, guys, this is amazing. We got, oh, let's see. I think I just got one question, one more thing, and this is great. We have Best Will Witkoski is from an adult daycare center in Lafayette, Indiana. So I know most of the people on this call are Mid-Atlantic, so it's great to have some Midwesterners in the audience. Guys, this is fantastic. We got through all the questions. I'm going to follow up with the audience with a recording, with a copy of the chat, with contact information for our entire panel. I'll make sure to throw in their information on the NAS. I'm not good at the acronym for the National Adult Day Services Association, the NASDM National Virtual Conference. And I really want to thank everybody for participating in a really engaging dialogue. And our fingers are crossed for Maryland with a reopening. Lauretta, if you don't mind, when you get information, send it to me so I can share it with everybody. And and let's see, a question: what is the difference between the Jpad and the iPad? That is a long. I know that's going to be a long answer there. What I'm going to say, I'll give you an opportunity to answer it very quickly, Rosita, because I got to run down the hallway. But guys, I'm going to get Rosita on in a couple of weeks for an entire hour. So we're going to dive into Jpad big time. But briefly, what's the difference?
All right, just 20 seconds, Steve, I promise you. Jpad, it's made for ADS. iPad is made for everybody. It's different ages. We are made for ADS, but nothing else. So try us.
Okay, great. Okay, guys, we'll see you at the next session, and I will follow up soon.